Other things that have been really fantastic would be how we approach Achilles tendon injuries, which is a very common injury. We have a lot of active patients of all ages. Historically, Achilles tendons were repaired with very traditional large open incisions, very protracted recoveries. And for the last few years, I've been trained and have been performing Achilles tendon repairs with a very, very small incision. And so we have special devices to do it, again, minimally invasive being the key word. And also, the repairs are so much stronger that I'm getting my patients walking and into physical therapy literally in half the time that we were doing just a handful of years ago. So that's been fantastic for people.